Hello, welcome. My name is Jen Johnson, and I am a Programs and Services Supervisor and Healthcare Navigator with the ARC Minnesota. Thank you for joining us for today's webinar, Social Security and Medical Assistance at Age 18. We are recording today's webinar, and it will be available on the Healthcare Assistance page of our website for future viewing. With that, let's get started. As you'll see, we'll be traveling on the road to understanding how Social Security benefits and medical assistance can support young adults with disabilities and how turning 18 impacts eligibility for these programs. First, we will talk briefly about the ARC Minnesota. The ARC is a grassroots nonprofit organization serving people with intellectual and developmental disabilities and their families across the state of Minnesota. We were founded in 1946 by parents who wanted better lives and opportunities for their children with disabilities and came together to advocate for their rights. We serve people from birth to the end of life and offer a wide array of information, assistance, and advocacy supports for the disability community. We have 6 regional offices: the Greater Twin Cities, Mid-State, Range, Southeast, Southwest, and West Central that serve people across the state. Under our logo, you will see the various ways you can connect with us by visiting one of our 6 regional offices, by phone, statewide, our toll-free number, or by sending an Ask an Advocate through our website. We also have 4 ARC's Value Village thrift stores that are located in the metro area. You can shop, donate, or volunteer as a way to support us and the services we provide to people with disabilities and their families. For more information about our stores, please visit arcsvaluevillage.org. As many of you may know, many other things change and relate to a young adult turning age 18. We have listed some of the other relevant topics we can assist young adults and their families with. However, we will not be discussing these in detail during this webinar. These other relevant topics include guardianship, financial planning, county developmental disability services, transition services through the school district, and vocational rehabilitation services. By visiting our website and clicking on the Ways We Help tab, you will find the complete listing of ARC guides. Many of the ARC guides break down these topics and provide critical information that help families and young adults understand their options, how benefits or systems work, and what to expect. You are also welcome to call us and ask to speak with an advocate about any of the areas above. Our objectives for today's webinar, they're here listed in no particular order. Highlight how Social Security benefits and medical assistance can support young adults with disabilities and why families may be interested in applying for them. Break down the supplemental security income, also known as SSI, and medical assistance, also known as MA programs. Review some specific MA programs for people with disabilities. Explain the connection between access to county developmental disability services and medical assistance. Walk through options, tips, and resources for young adults and families. If you're a parent, you may be listening in today because you've been told to apply for Social Security benefits and medical assistance for your young adult. You may have heard about these programs and benefits from other parents. You may not understand why you should, need to, or want to apply, and that's okay. Supplemental Security Income, or SSI, is a monthly cash benefit program administered by the Social Security Administration. It can be used to pay for food, shelter, clothing, personal comfort needs, and furnishings for adults with disabilities. A family may want to access SSI benefits in order to help meet the daily living expenses and support needs for their young adult. Medical assistance, or MA, is Minnesota's Medicaid program designed for certain groups of people who typically have low income, including people with disabilities. Medical assistance gives access to health care. For adults with disabilities who aren't working, don't have access to insurance through a job, and/or lose private insurance coverage through their parents when they turn 26, medical assistance may be their primary health insurance coverage. In addition, MA funds critical disability services and supports through county agencies. Many services that support people with disabilities to live, work, gain skills, get around, or be involved in their communities are paid for by medical assistance. No private insurance policies cover these services. In order to access them, MA needs to be in place. A family may want to access MA for their young adult in order to meet their healthcare needs and to pay for county developmental disability services. Now we'll take a closer look at Social Security benefits. The Social Security Administration, which is run by the federal government, administers 3 programs. These include Supplemental Security Income, or SSI, Social Security Disability Insurance, SSDI, and Retirement and Survivors and Disability Insurance, known as RSDI. Supplemental Security Income will be the main focus of today's presentation. SSDI is a federal program that provides monthly cash benefits to people who have worked, paid Social Security taxes, and now have a disability that prevents them from working. RSDI is another program providing a monthly cash benefit to people who have retired and have paid Social Security taxes, to survivors like widows, widowers, and minor children of someone who has passed away and qualified for retirement or disability benefits, and to people with disabilities who are younger than full retirement age, which is 62 years old. So what is SSI? Supplemental Security Income is a monthly cash benefit for people between the ages of 18 and 64 who have a disability and limited assets and resources. People age 65 and older who have limited income and resources may also be eligible. Qualifying children and youth under the age of 18 may also be eligible if they meet the disability definition, which is different than the one used for adults 18 and up. Our focus for today's purpose will be on adults between age 18 and 64. Unlike the 2 other programs through Social Security, SSI is a cash assistance or federal welfare program. People who qualify for SSI may have not paid into the system through Social Security taxes. Social Security's definition of disability, which is defined as severe physical or intellectual disability that has lasted or is expected to last at least 1 year or result in death. That is the first criteria that someone must meet in order to be eligible for SSI. The Social Security Administration also uses a functional assessment to decide if the applicant could do their old job or if they could do any other type of work using their medical condition, age, and background as factors. The condition must limit the ability to work, which is defined as substantial gainful activity, or SGA. This year, if an applicant is working and earning more than $1,220 a month, Social Security considers that substantial gainful activity. The applicant would therefore be eligible for SSI benefits. The link here on the slide is to the Social Security Administration's website where you can find the current SGA level. This amount typically increases every year. And again, the $1,220 a month, that is the SGA level for 2019. Assets and resources are another eligibility criteria that someone must meet. Assets are things that the applicant owns. Resources are cash and other things that you own that could be converted to cash. Some assets are excluded, including the home that the applicant lives in and 1 car that is used to get to work and medical appointments. The applicant's countable assets must also be at or under the program limits in order to qualify. For a single adult, this is $2,000, and for a couple, it's $3,000. And citizenship status is the final eligibility criteria that someone must meet. They must be a U.S. citizen or a qualified alien. For SSI, the maximum monthly benefit for a single adult is $771 a month in 2019. Again, SSI benefits can be used to meet the daily living expenses and personal needs of the recipient, including shelter, food, clothing, and furnishings. The link here again is to the Social Security Administration's website, where you can find the current maximum monthly benefit for SSI. And again, this amount typically increases every year. Now we'll shift our focus to medical assistance. So what is medical assistance? Medical assistance is Minnesota's Medicaid program for people with low income. MA is designed for children and families, pregnant women, adults without children, seniors, and people who are blind or have a disability. Most people in Minnesota qualify for MA due to their income and household size falling within program guidelines. They also must meet other eligibility criteria, including citizenship and residency, for example. Others qualify for MA on the disability basis. We will get into more detail about qualifying this way in future slides. Most people who are income eligible for medical assistance are put onto what's called a prepaid medical assistance plan, or a PMAP. This means that enrollees who fall into this group choose a managed care organization like Medica, Health Partners, or Blue Cross based on the county they live in and receive their MA benefits through that organization. If I am on managed care MA, again, this is also called a PMAP, and I choose to get my MA benefits through Medica, that means I have access to doctors, dentists, specialists, clinics, and hospitals through Medica's network. Some MA enrollees are on FeeforService or straight MA and do not have to choose a managed care provider. Providers that these enrollees see for medical care bill the state directly for services they've provided. There are two ways that someone qualifies for straight MA, either by having private insurance that the county has reviewed and deemed cost-effective, or by going through a disability certification process and qualifying on the disability basis. So what are disability certifications? A disability certification is a process where an applicant's eligibility for a benefit or program is determined based on a review of medical documentation. There are two ways that someone can be certified disabled in Minnesota. One is through the Social Security Administration, or the other way is through the state medical review team. When we discussed what SSI is, we talked about Social Security's disability definition. Applicants who are applying for Social Security disability benefits like SSI must meet disability criteria and provide documentation from a variety of sources about their diagnoses and conditions. If they are approved, they have a federal disability certification. The State Medical Review Team, also called SMRT, is a group at the state level who does disability certifications for healthcare program eligibility. The SMRT uses the same disability criteria as Social Security and also requests disability documentation in order to decide if the applicant's diagnoses meet the criteria. If an applicant is approved, they are certified disabled and therefore eligible for medical assistance on the disability basis. If someone is certified disabled by the SMRT or SMRTed, that does not mean that they are automatically eligible for Social Security benefits. Why would someone need to be certified disabled? For medical assistance, applicants may want to be certified disabled in order to qualify for straight MA. Straight MA is what funds county disability services and supports. Straight MA will allow access to these services. Most of these services are not covered by managed care MA, which is the kind of MA people are typically put on when they qualify based on their income and household size. If an applicant with a disability is income eligible for MA, They can request to be certified disabled by the SMRT, so they're excluded from managed care MA. For Social Security, applicants need to be certified disabled if they want to qualify for disability benefits like SSI. We encourage people with disabilities to consider what is important to and for them when making decisions about how and when to access services and benefits. Parents, family members, and others who support the person can help too. For medical assistance, just because someone has a disability does not necessarily mean that they need or want to qualify on that basis. There could be other healthcare program options that work better for them. If you have questions, there are resources, including us here at the ARC, that can provide information and assistance to help you make an informed choice about what's going to work best based on your unique circumstances. Now we'll look at some of the MA programs that are specifically designed for people with disabilities of different ages and in different stages of life. For all of the following programs, disability certifications are required. The first is Fee-for-Service or straight MA. There are two ways an applicant could be eligible for straight MA. One, if an applicant's income and household size falls within MA program guidelines and they need to be excluded from managed care MA, the county can refer the case to the state medical review team. The SMRT will either approve the case or deny it once they've reviewed all disability documentation. If the applicant is approved and SMRTed, the county then approves the MA case using the disability basis and opens the coverage. The second way is if the applicant is receiving SSI and has been certified disabled by Social Security, they are eligible for disability-based MA as long as they meet the program rules for the medical assistance program. Medical providers bill the state directly. Enrollees in this program must see doctors, dentists, etc., who accept fee-for-service MA. For a household of one, the monthly income guideline for this MA program is $1,041 a month, and the asset limit is $3,000. The second program is Medical Assistance TEFRA. TEFRA is a program for children with disabilities up to age 19 who don't qualify for medical assistance due to their parents' income being above the program guidelines. Parents are assessed a monthly fee based on their adjusted gross income from their most recent federal tax return. Children, as a part of the application process, must be certified disabled by the state medical review team. These children are usually ineligible for Social Security benefits and can't have their disability certified through the Social Security Administration due to their parents' assets and resources being above program guidelines. Even though the child's condition could meet Social Security's disability criteria, they won't receive the monthly cash benefit again because of parental income. Please refer to our relevant ARC guides for more detailed information about these programs. The third MA program is MA for Employed Persons with Disabilities, also called MAEPD. This is a program for people age 16 and up who are working, earning at least $65 a month, and are paying Social Security and Medicare taxes. Enrollees pay a monthly premium based on their income and their household size. The program allows enrollees to work, maintain MA eligibility, and build assets and save for the future. The asset limit for the MAEPD program is $20,000 compared to the straight MA program for someone with a disability who isn't working, which is $3,000. Another program is Special Needs Basic Care. This is a voluntary managed care program for adults aged 18 to 64 who have qualified for MA on a disability basis. This program allows access to both straight MA services like waivers, county developmental disability services, and managed care benefits and incentives. The choice of managed care organizations varies by county, and this is an opt-out program, meaning that if the enrollee receives a letter about special needs basic care and takes no action, they will be automatically enrolled. Enrollees can opt out at any time and go back to just straight MA if they prefer. Why can special needs basic care be of benefit to people with disabilities? There are more choices. It can be challenging for a person with a disability to find doctors and dentists who are accepting new patients that have straight MA. Through SMBC, the person with a disability would have access to benefits not covered by straight MA, like a gym membership or a healthcare incentive program, like for instance, earning gift cards for doing certain health activities. And finally, there's an individual care coordinator assigned to work with the enrollee who helps with setting up medical transportation, navigating healthcare services, and more. Again, please refer to the relevant ARC guides for more information about these programs. Now we'll switch back to Social Security and talk about the application process for SSI. Please refer to the ARC guide for SSI for more detailed information. If you have questions about the application process, you may call the ARC and ask to speak with an advocate. The first step is logging onto the Social Security Administration's website and accessing the Disability Starter Kits. The Adult Disability Starter Kit is for applicants age 18 and up. It includes a fact sheet that gives general information about Social Security programs and important information to know before applying. It also includes a checklist of information to gather and a medical and job worksheet to complete. Call Social Security to set up an in-person appointment at your local office. The 1-800 number is listed in our ARC guide. When applying for an adult, it's helpful to have completed the online adult disability and work history report prior to your appointment. It's also critical to bring copies, not originals, of all of the requested documents and proofs that are listed on the checklist from the Disability Starter Kit to the appointment. Once Social Security has all of the needed and requested information, it can take anywhere from 3 to 6 months for applicants to get a response on their application. Applicants receive either an award letter if approved or a denial letter if denied. If applicants are denied, it's usually due to insufficient medical information, resources, so Social Security believing an applicant's resources are above the program limits, or substantial gainful activity. So the applicant is working and earning above the monthly substantial gainful activity limit. Applicants have the right to appeal. There are 4 steps under the appeal umbrella. The denial letter spells out the applicant's rights and critical timelines in detail. Here you'll see some critical tips we want to make sure to share with families when they're considering applying for SSI for their loved one. Where an applicant lives and who pays for their food and shelter costs directly impacts the monthly amount of SSI benefits they may be eligible for. If the applicant lives alone or in someone else's home and pays for all of their food and shelter costs, they can get up to $771 a month, the maximum monthly benefit amount for 2019. If the applicant lives in someone else's home and someone else pays for part or all of their food and shelter costs, Social Security may reduce the maximum benefit the applicant can get. This is called in-kind support and maintenance. The benefit may be reduced by 1/3, meaning the maximum the applicant will receive in SSI benefits is $514 a month. So that being said, it's critical that applicants and families provide documentation during the initial application showing that the applicant does pay their fair share of shelter and food costs if that's actually the case. So an example, if an applicant lives with 3 other people and the total monthly amount they all spend on food and shelter is $4,000 a month, the applicant's fair share would be $1,000. Completing some of the application information online through Social Security's website can help make the in-person appointment go faster. If applying for an adult, you can complete the Adult Disability and Work History Report online before going into your local office. Taking the time to gather all of the documentation and information that's listed on the checklist and the disability starter kits will make a tremendous difference in the application process. Again, do not give Social Security original documents. Make copies of everything. We also recommend keeping copies of everything you submit together in one place for your records. Designating a representative payee can be another important part of the application process. A rep payee is a person or an organization who receives Social Security benefits on behalf of a recipient who cannot manage their own benefits. Many people with disabilities are able to manage their Social Security benefits without support. For people with more significant disabilities or vulnerabilities, it's important that families discuss this important role, understand the reporting requirements, and decide together if this would be the best way to support their loved one. If an SSI recipient is working, they will almost always end up better financially. Their total income will almost always be higher, even if their SSI benefit amount goes down. There are also programs and features included in SSI law that can support someone in working and still being eligible for SSI benefits. Now we'll look at the application processes for medical assistance. There are a few different ways to apply based on the applicant's situation and circumstances. MNsure is Minnesota's health insurance exchange that was created as a result of the Affordable Care Act. It's a platform where most Minnesotans can go to apply for healthcare coverage. MNsure's online or paper application is for applicants requesting income-based healthcare coverage, which includes MA, Minnesota Care, or qualified health plans, which are commercial health plans sold through MNsure's website. Fee-for-service or straight MA, and are not receiving SSI benefits, and MA TEFRA. Please note, the online MNsure application does not tell families about TEFRA as an option. Children applying receive a denial due to parental income and household size. Our navigators can help families with tools and information on the next steps to get the TEFRA application moving forward at their county. The online MNsure application is preferred as it's faster and applicants can, in most cases, get an immediate initial eligibility determination. Applicants can also follow up with a servicing agency, which is their county of residence or the Minnesota Care office, etc., much more quickly. Paper MNsure applications go into the applicant's county of residence. Applicants must wait until a county financial worker enters the information into the MNsure system before receiving an eligibility determination, which can add a few weeks' wait to the process. Based on the initial eligibility determination applicants receive from the MNsure application, follow-up is typically needed with the servicing agency. If an applicant is MA eligible, they will need to follow up with their local county's financial unit, typically the county's MNsure financial team. Applicants eligible for Minnesota Care follow up with the Minnesota Care office in St. Paul, and applicants eligible to buy qualified health plan through the MNsure website typically contact an insurance broker for assistance or follow up with the MNsure contact center for help. The application for certain populations is a paper application used for certain people in certain situations to apply for MA. Here you'll see a screenshot of the front page of the application on this slide for your reference. So who is this application for? Applicants who have a certified disability, so they're receiving disability-based Social Security benefits or have been certified disabled by the state medical review team. Medicare enrollees who are looking for help paying for their Medicare costs through medical assistance, or applicants who want to apply for medical assistance for employed persons with disabilities. Some counties want families who are applying for MA TEFRA for their children to use the application for certain populations. Applicants submit this paper application directly to their county of residence with required verifications. So those could be copies of private health care or a Medicare card, pay stubs if you're working, Social Security award letter, bank statements, and more. Most applicants receive a response on these types of applications from the county financial unit within 60 days. Sometimes it's within 30 days. It depends upon how backed up the county is on processing. Here are some MA application tips that we wanted to make sure are shared with families who are considering applying for MA for their loved one. Please refer to relevant ARC guides on our website for more detailed information on medical assistance programs. You may also call us with questions and ask to speak with a navigator. It is critical to keep copies of all documents you submit to the county for your records. Paperwork routinely gets lost, separated, or misplaced at the county. If you need to resubmit it, it will make life much easier if you have copies of everything you've sent in. It is also important that you write the case number on top of each page you submit to the county agency so documents are correctly routed when scanned into the county's computer system. When following up on a healthcare application, it is best practice to maintain a call log. Keep your call log in an accessible, safe place. Write down the date, time, and name of who you speak with. Note what is discussed and what actions the worker said they would take. If you need to appeal or if you encounter serious issues with the application, the call log will be a tremendous help in problem solving and holding the system accountable. Request that the county review the applicant's private insurance policy if they are enrolled in one to see if it's cost effective. It's possible to have MA reimburse families for the applicant's portion of the monthly private insurance premium and deductible, as well as co-pays or co-insurance. The county will send out more paperwork to be completed. Please refer to our guide on cost-effective health insurance for more detailed information. Similar to Social Security's representative payee, a parent or guardian or family member can be designated as an applicant's authorized representative for healthcare purposes. An authorized rep may receive healthcare information on the applicant's behalf and communicate or share information with the county agency. Families should discuss this important role with the applicant and decide together what will be best. Not all people with disabilities need an authorized representative for healthcare purposes. One of the biggest differences between the Supplemental Security Income Benefit and the Medical Assistance Program is at what age a person is considered an adult. Social Security considers someone an adult once they turn 18. Even if the person lives at home with their family, once they are 18, they're considered a household of one. Parental income no longer counts for program eligibility. Only the applicant's income and resources count. Unfortunately, medical assistance does not define an adult in the same way. For MA programs, someone isn't considered an adult until they are 21 years old. Parental income still counts for MA eligibility even once someone has turned 18. Household size is also calculated differently for MA program eligibility. Tax filer or dependent status is considered first when looking at household size for income-based medical assistance. A common scenario that families encounter when applying for MA at age 18 is, due to parental income, their young adult is eligible for MA TEFRA. Parents must then pay a parental fee until their child's 19th birthday in order for them to access services through MA. Families whose incomes and household size fall within the program guidelines for MA may apply for their young adult at 18 and find that their child is eligible for managed care MA. If the family, including the applicant, are enrolled in private insurance, the county can review the policy and could deem it as cost effective. That then means the young adult is excluded from managed care MA and would be on straight MA. While this type of MA may pay for some services they're looking for, it won't pay for other county disability services like waivers because the person is not on disability-based MA. This scenario can cause confusion and can be difficult for families to navigate. So at age 18, how does a family or young adult decide which program or benefit to access first? There are some important questions to consider. How families answer will help them decide the best path to move forward. These include, does the young adult have private insurance coverage? Is there an immediate need for medical assistance coverage? So for example, is the young adult being offered a waiver slot or a service that only disability-based MA can pay for? Are the young adult's financial needs the most pressing or top priority? Is the family struggling to meet the costs of shelter, food, clothing, and other daily living expenses for the young adult? Another consideration that often is the deciding factor has to do with understanding disability certifications through the state medical review team in Social Security. In general, if a young adult starts first with applying for Social Security benefits at 18 and is approved, they will have a federal disability certification. Then, when they apply for MA, they're considered their own household and parental income no longer counts. If they meet all other program criteria, they are then approved for disability-based MA and do not have to go through additional disability processes or submit extensive disability documentation. The actual application process is also more direct. Applicants apply for MA directly to their county of residence and send a copy of their Social Security award letter with the application. They get a response within 30 to 60 days from the county. If access to MA is the young adult or the family's priority, they can certainly start with that process at 18. There are many other factors that come into play, including the state's disability certification process if they're seeking disability-based MA. This adds at least 2 to 3 months to the application process and requires extensive disability documentation. If the young adult is approved by the state medical review team, they are then required by their county agency to apply for Social Security benefits. They will be asked for similar disability documentation and will have to wait 3 to 6 months for a response on their Social Security application. In many ways, these processes are duplicative. For many of the reasons we've just discussed, many families decide to first start by applying for SSI benefits at age 18 for their son or daughter. Here are walkthroughs of the 2 options families have for the young adult at 18 for accessing MA and SSI that I just described. So again, option 1 is applying for SSI benefits for the young adult the first day of the month of their 18th birthday. If the person is approved, use the application for certain populations to then apply for MA benefits. The application is sent to the county of residence with proofs, including a copy of the Social Security award letter. The applicant, if they meet all MA program eligibility criteria, will be approved for disability-based MA. This process takes anywhere from 3 to 8 months, depending upon multiple factors. The second option is starting by applying for medical assistance. The applicant submits an online MNsure application and answers yes to the disability questions. The applicant follows up with their county of residence and requests that their case be referred to the state medical review team for a disability certification. The county will ask why the applicant is seeking disability-based MA. The county will also ask if the applicant has applied for Social Security benefits. Once the state receives the case, the applicant must submit disability documentation. The state medical review team takes about 2 to 3 months to review cases and make their decision. If the SMRT approves the applicant's case, the county opens a disability-based MA case and will then require the young adult to apply for SSI benefits. The applicant then applies for SSI benefits, which takes about 3 to 6 months. Following these steps can take anywhere from 5 months to a year, depending upon multiple factors. Another possible option for young adults looking for more immediate access to health insurance is listed here. This could be for someone who is losing private insurance coverage at age 26 and isn't working or doesn't qualify for health insurance through their employer. The applicant submits an online MNsure application and applies for income-based MA. Depending upon the applicant's situation, they may be approved for managed care MA, or if they have private insurance that's cost-effective, straight MA. This is also assuming the applicant meets all other MA eligibility criteria. This will then allow the person access to MA benefits and will get them into the system. Then they apply for SSI benefits. If they're approved, they then call the county financial worker for the MA case and submit a copy of the Social Security award letter. The county may ask for additional proofs or information. MA eligibility basis will then be switched in the county's computer system from income-based MA to disability-based MA. Following these steps can take anywhere from 3 to 7 months, depending upon multiple factors. Now we're going to review some resources. As I've mentioned throughout this webinar, we have many wonderful resources on our website at arcminnesota.org. Please look for relevant ARC guides that were mentioned during today's webinar, as well as the healthcare assistance page with more details about how navigators can help individuals with disabilities and their families to navigate the health insurance system. The Minnesota Department of Human Services website, Special Needs Basic Care for People with Disabilities. You'll see the link here on the screen. For enrollment information, questions and answers, and covered services. And then the Social Security Administration for disability starter kits, the online application, and Social Security publications that go into detail about the programs we discussed today. Another wonderful resource that I highly recommend for individuals with disabilities and families is Disability Benefits 101. Disability Benefits 101 has benefits videos. So if you click on the videos tab on their homepage, premium estimators, MA and SSI information, and the live chat with an expert feature. Work Incentives Connection. The Work Incentives Connection has fact sheets on Social Security benefits and healthcare programs, resources and information for individuals who are working and receiving benefits. And finally, MNsure. MNsure has the online application we mentioned multiple times during today's webinar, healthcare program information, and to access the assister directory, click on the Get Help and Find an Assister on their homepage. And that's how you can find a navigator in your area who can assist you in understanding how to apply on MNsure's website. Thank you very much for joining us today. I hope this webinar was informative, engaging, and helpful. And again, please don't hesitate if you have any questions or concerns to please give us a call and ask to speak with an advocate about any of the programs or resources we've discussed today. Thank you very much.